Funky Politics.
Funky Politics Show.
Funky Politics.
Funky Politics.
Funky Politics.
Funky Politics. Powered by MLGW. Memphis Light Gas and Water.
You're listening to Funky Politics, powered by the Kazuki Network. I'm DC, one of your capable hosts of this program, and you know what? Memphis Light Gas and Water. MLG&W is our presenting sponsor, and I tell you what, they do a wonderful job here serving our customers in Memphis. Doc Ward, what say you, brother?
I say MLGW pays our bills. Uh-oh. Funky Politics solves your ills. Man, this show's so cold it gives you chills. It's real right and funky.
I like that, man.
No frills. That's what I say.
No frills.
I say it all day long. But let me ask you something.
What you got?
Would you, this is a question for you, black man.
Uh-oh.
Would you give your fingerprints to the police department? Just offer them up and volunteer them without them asking you or anything like that. Would you do that?
No.
You wouldn't?
No.
What about you, LT? Would you do it?
Absolutely not.
Okay, so why do you give your fingerprints to Apple when you go out and buy this phone and press it every time to identify you?
I never thought about that.
You never thought about it. I bet you didn't. And
That's
a lot of people
I never thought about that.
Millions and millions of people
Wow.
did not think about it. But I guess what? After this situation with Facebook and 37 million people and rising whose information has been compromised, I bet you more people are going to be thinking about it.
They said 87 million now.
Yeah, because Facebook not only has your fingerprints, Facebook has your face, Facebook has your name, Facebook has your address. And guess what? They're packaging it up and they're selling it like mortgages and securities right now.
Wow.
And that's what's got us in such an issue with these Russians out here, because your identity has been compromised just by you owning the phone and gaining access to it.
I never thought about that.
Yeah.
Never thought about it.
Yeah. So as this election rolls along, and I know, LT, you were telling us about all these people that are in the election, I'm happy to see so many people being active, but I want to see elections that have integrity. And if we got to go back to paper and pen and wait all night just so we can get it right, that's where I'm going to be, because that's the thing that's most important to the public, I think, right now.
So that's why you see so many women deciding that it's time to get back into this to have our issues addressed. I just read something that said that there are over 300 women who are running for Congress, and in both parties, trying to make sure that their voices are heard and their issues are addressed.
Well, we want to make sure they're addressed, but we also want to make sure that the election is valid.
Well, speaking of women and issues and, professionals, we've got one with us today, Dr. Alisa Haushalter.
That's right.
Yeah, she is a capable division director for the Shelby County Health Department. And you know what? She is a consummate healthcare professional known worldwide. And you know what? I'm glad she's here with us today, guys. You know that?
Yeah, she's not elected, but she is selected, so she will be affected. So we got to make sure that our elections are not infected. So we're going to talk to Dr. Haushalter in a minute, right after we take a little time to relax and reflect on what we've been through and what we're talking about right here on this funky show, Funky Politics, powered by
the Kazuki
Network.
Funky Politics.
Plus One lip sync champion Latasha Peoples.
Staring in the mirror, gonna change my ways. I wanna make Memphis a better place. I see a neighbor in need, but what can be done? Instead of buying shoes or a pretty dress with just $1 a month, you can help the rest. It starts with you. Plus One.
Giving back through Plus One will make a difference for families in crisis.
It starts with you. Plus One. Grandma's message couldn't have been any clearer. If you want to change Memphis, look in the mirror. It starts with you. Plus One.
I remember when we got help from Plus One.
And now we're helping others.
Hey, Memphis, you can make a change.
You too can make a difference.
Artivism.
Artivism features conversations with artists, creatives, and citizens working at the intersection of art and social activism. And I'm Linda Steele, your host. I'm a grant maker, change maker, social venture capitalist, And I invest in individuals and projects that use the arts as a vehicle for social change.
Artivism on the Kazukian Network.
This is Dr. Alisa Haushalter, and you're listening to Funky Politics on the Kazukian Network.
You're listening to Funky Politics, powered by the Kazukian Network. I'm DC, sitting right here along with my great co-host, LT. How are you?
Hanging in there today. How about you?
I don't know. I'm doing pretty good. You know who else we got? Doc Ward. Doc, what's up?
Somebody had to make this show funky again.
And you brought yourself in. Thank you, sir.
Thank you. Yeah, of course.
It couldn't be funky without you.
It couldn't be funky. Well, actually, it couldn't be nothing without me, but it definitely couldn't be funky.
This is Funky Politics, folks.
There you go.
And you know what? We're visiting this evening with Dr. Alisa Haushalter, who is the Division Director for the Memphis and Shelby County Health Department. Or is it the Shelby County Health Department now?
It is the Shelby County Health Department.
Oh, that's right. The Shelby County Health
Shelby
Department.
County,
program. How are you?
Shelby County,
I'm
Tennessee.
doing great. I'm happy to be here.
Yep.
Good to have you back on this program. Let's just, you know what? We want to talk a little bit about the background. Your background in terms of public health. You're not native to Memphis. As a matter of fact, you come from a lot of different places and have been a lot of different places. Talk to us a little bit about that.
Sure. So I'm originally from Pittsburgh, Pennsylvania, the inner city of
Go
Pittsburgh.
Steelers!
Go Steelers!
I'm sorry about that, guys.
That's okay. I grew up right by the stadium, so I'm a Steelers fan. We wrap our children in the terrible towel at birth.
Absolutely.
Wow.
And that's how we do it there. But I spent 30 years in Nashville. I'm retired from public health practice there. Then spent 3 years in Delaware. And then came Delaware, yes.
Wow.
At the DuPont Institute, which is Nemours healthcare system for children. Then I was recruited back to public health practice here in Shelby County, and I'm happy to be here. I've been here for 2 years.
Wow. From the Burg to the Ville, across to Delaware. Guess what? The doc's been everywhere. But right now she's here with us to talk about something very, very important.
Yep.
And very, very funky in a not so positive way. And, you know, I think has this been about a year or two since we lost Prince? Was it?
2 years.
Couple
April.
years.
Has it been 2 years already?
2 years?
April 20, because April 20th.
I know, and they're getting ready for.
Ask me how I know.
Yeah, there's a celebration and a bunch of things that are going on in Minneapolis pretty soon. But I think that, I believe, at least for me, it was the first time that we actually came face to face with the opioid, was it the drug or whatever the substance called fentanyl. I had never heard of it before, really. I'd heard of maybe vaguely. I was still getting over the propofol with Michael Jackson.
Well, now that's true. That is very true.
So I heard this new thing that was supposed to be 30 times more powerful than Tylenol, 70 times more powerful or whatever. But that was when I think we really first started hearing about it, when he expired due to an overdose or amount of, and then all of a sudden, just like like a blizzard or whatever, everything started rolling down and rolling down and rolling down, and all of a sudden you started hearing in places like West Virginia, Kentucky, and Pittsburgh, Eastern Pennsylvania, Western Pennsylvania, where you were from, it became an epidemic levels, this whole issue with opioids. And we found out that we had actually been confronted with it as a nation for some time now, and it had yet been unaddressed. Is that not correct, Dr. Haushalter?
I would say it's not been adequately addressed.
All right.
and then I would also add, there's some communities like Pittsburgh, Baltimore, that have had a historic heroin addiction problem, and that evolved into an opioid problem with fentanyl and some others. So for each community, it's a little bit different. I think that's the key point.
So can you kind of explain to us what that's all about? Because it's actually now, it's on the front page, on the front lines of all the news issues we have now.
Well, it's really reached an epidemic proportion, and what we know is different about this than the historic problems we've had with heroin is that this was really fueled by the pharmaceutical industry and prescribing pain medications for individuals. So fentanyl is a really strong painkiller that's good for people who have terminal cancer, chronic pain. But if you have your wisdom teeth out, you don't need fentanyl. And so there was overprescribing. People got addicted to it. Many of these synthetic substances, the pharmaceutical company told providers, physicians, nurse providers, that they were not as addictive. And they actually are very highly addictive. So individuals became addicted to what was prescribed. Then we stopped prescribing, so they went to the street to get either heroin or other products that are actually being made in China, Mexico, and other places and brought into our community.
Wow.
You're listening to Funky Politics, powered by the Kazuki Network.
So when you talk about community, oftentimes we hear about the big cities who are starting to face the epidemic. But I used to live in Western PA, and I know in Fayette County that was a problem. Can you talk to us about any differences between how the epidemic is affecting rural communities versus urban communities?
So with a lot of urban communities, there was a historic opioid or opiate addiction that was related to heroin. If you go to Pittsburgh, people have been using heroin for a long, long time, really back to the 1900s, 1920s even, very, very early, and peaked in the 1950s. But you had very rural communities. If you look at the state of Tennessee, East Tennessee is really the nexus for the current opioid crisis, and much of that is through prescriptions that were provided by providers to individuals, and then there became sales of those pills. It's a little bit different.
Why is East Tennessee the nexus versus anywhere else?
It's just the way that it kind of developed over time. Those are communities that also used meth, where inner city communities may have used crack or heroin. So any community is slightly different. The same thing with violence. It's not the same in Memphis as it is in Nashville. There are different things that contribute. So if you're going to solve the problem, you really have to look local.
Well, so is that part of the Appalachian Trail kind of thing? Or is there just something about Eastern Tennessee? I'm just curious about that.
It's just being in a rural community,
Okay.
and then there was easy access to providers who prescribed.
Okay.
So you're saying people want to get high. They don't have access to the same type of drugs that other people do. So they get what they can. And one of the things they could do was get this synthetic, well, first of all, the first opioids you said were actually prescription drugs.
Well, no,
to the degree.
the current epidemic is from prescription drugs,
Right.
but opioids really come. Heroin is an opioid.
Right.
And I think we need to make the distinction to our listeners also, because we've talked to Colonel Wright with MPD, that's Memphis Police Department, and they've laid it out for us on some other shows. Let's talk about opioids being there's just not one thing here.
Right.
I think heroin and fentanyl follows into that with some of that, and then you've got those prescription pills. Am I right? Am I not right, Doc?
Yeah, there's any of the painkillers that you get prescribed, the majority of those are going to be an opioid. So let's just say oxycodone, but it may be Tylenol with codeine, which a lot of people have taken. Vicodin.
Okay.
All of those are actually opioids and highly addictive.
Right.
Good night.
So like we're saying, in the rural areas, you might not have access to the same types of substances, so you get what you can. But now with this synthetic coming in, you said pharmaceutical companies are to blame, or are considered to be to blame to some degree for it. How are the pharmaceutical companies getting involved in the sort of, I say, black market side of it? If you're not prescribing it, you're getting it off the black market. How are they involved in that, or are they involved in it?
Yeah, so I'll just be clear, I didn't say they were to blame. I think it's a contributing factor that they made.
Well, I'm sorry, the president said it would have blamed.
That's okay.
Put that on you.
But I want to add to that, because I'm a provider, I'm a nurse by training, that at the same time that the pharmaceutical companies were developing all these synthetic drugs to manage pain, healthcare providers were being told that pain was the fifth vital sign. And we actually are scored on whether or not our patients report that they had pain or not.
That's right.
Okay.
So then the provider started over-prescribing because they didn't want patients to be in pain. So we really all have contributed to that.
Right.
Then you look at all the marketing that's on TV. So you have patients, me or someone else, who will go in and demand something to manage the pain. So it's a combination of all of those things together that I think have contributed. The pharmaceutical industry, as they've pulled back, as we stop prescribing, we know what happens in a business model.
Right.
Those who sell drugs started manufacturing illegally similar drugs and then bringing them into the community. And people who were already addicted then started using those things from the black market, including heroin, including fentanyl that's made elsewhere. We talked about Prince earlier.
Right.
There's sort of a belief that he didn't know he was buying fentanyl, or whoever purchased it for him.
Oh, come on, Doc. Come on.
He knew he was buying an opioid, but he didn't know how much fentanyl was in there.
Yeah.
Right.
And so that's why we have the overdoses, because there's really no quality control on the black market.
But if I'm buying that drug, I want the pain to go away. So whatever it is, I just know it makes the pain go away, right? I don't know if it's fentanyl. It could be barbiturate. I mean, whatever it is, I just want it to go away. And so how is it that I can go to a doctor and I got a prescription? I get a prescription for 90 pills in a 1 month period. To me, isn't that you said that I can take this 3 times a day. Come on some strong stuff like that. Now isn't that a little bit over the top for a doctor to prescribe? I'm not talking about the manufacturer. I'm talking about the physician.
Well, see, it makes me question the profitability of these drugs, right? So at the end of the day, if the doctors are prescribing more, are the pharmaceutical companies pushing it because these are more profitable than some of the other drugs in their portfolio? So can you speak to us about whether or not it helped the medical institutions make money or close the gap?
I won't necessarily say that about profitability. One of the things that does happen is if a patient is discharged and they come back within so many days, the provider is penalized for that.
Wow.
Because of the pain? Because you didn't address the pain?
Whatever reason they come back. Right. So just say I had surgery and I come back in 2 or 3 days and I'm saying my pain's not controlled. The provider actually is penalized. So there is a financial motive. It's not necessarily profit in the way that you're discussing profit. And all of those things are being addressed in the current opioid epidemic. The other is really encouraging patients to have a conversation with their provider. I have had surgery. I did not take those pain pills. I knew there were other options, and so I demanded other options and not to have something that was a synthetic
and I think
opioid.
that's why we get it here first, and we get it right, and we get it always right here on Funky Politics on the Kazuki Network. And I think the key word, the options. There are other options to this continued use of strong painkillers, and that's what they are. I mean, but they're painkillers, but they're eventually killing them because they're falling into hands of somebody who should not have them.
Yes.
And that's where the black market comes in.
Exactly.
So how did this get defined as an epidemic? What was the trigger that made someone say, we need to address this growing problem in the country?
So that's a really interesting question because even within the health department, we had a lot of discussions about the term epidemic. But the actual meaning of that term means that you have deaths that exceed what you would have expected for an issue.
Okay.
That we know is true with opioids. But then we have to begin to look at addiction as a chronic illness and not a moral or behavioral problem. It is a chronic illness. And so if we had people dying from diabetes left and right, we would call it an epidemic. If we had people who had measles, which we've had measles here, we would call that an epidemic. So that's the right term to use so that we can look at it from a public health issue and not a law enforcement.
So if you go back to the 90s and we always compare the crack epidemic to, this opioid epidemic. And so what's the difference in the sense of urgency in comparing the two? Because people died as a result of crack overdose as well.
It wasn't a crack epidemic. That's the difference.
Well, that's the truth. Now she just said that the epidemic piece of it was the crack was the crack issues that we had in the 80s, and then was that considered an epidemic from a public health standpoint?
As a public health professional, I would say the crack problem we had in the 80s was an epidemic.
Did the president,
was it defined?
But did the president say
the president didn't define it that way.
That's what I'm saying. You're saying it retrospectively.
Yeah.
We didn't have a crack epidemic. You had a crack problem. You didn't have a crack epidemic.
But we all know that the reality of what was happening on the street.
Yeah, that's true.
There were problems and people were dying and people were sick and a lot of the same, I guess, characteristics that we see in opioids we saw in the 90s, 80s and 90s.
Right. But you didn't have a crack epidemic.
It wasn't called that.
It was, and therefore you could not address it as a public health
So what's
issue.
the difference? Is it because the president has come forward or the previous administration termed it an epidemic?
I think it's a combination of things. First and foremost, I think we've learned a lot about the crack epidemic. We cannot arrest our way out of addiction in our country. We have to take a broader approach. So that's one thing that I think we need to recognize, that there was lessons learned through what happened in the 80s. The other is, and this is my opinion, I'm not speaking on behalf necessarily of anybody else, is there are other people who have been impacted by the problem now.
Right.
And it's hit closer to home. So they have a better understanding of the reality.
But now, whose home though? Whose home though has it hit closer to though? And I don't want to call you on the carpet on that because it hit close to home. In my family back in the 70s, the 80s.
There's nobody.
Now who's home now?
Nobody in Congress looked like your family.
Oh well, then that's true.
Maybe
Walter Fontroy.
Maybe working in the kitchen in Congress.
But anyway, but I get your point. But you're right. Hitting closer to home, and I think that's where we are now with this. Opioid epidemic.
Yeah.
And it wasn't a crack epidemic, So go ahead. I'm sorry.
Yeah, well, I mean, we're gonna talk about it. We're not gonna dance around it. We're gonna get funky with it. But you're listening to Funky Politics, powered by the Kazukian Network.
Funky Politics is on.
It's Eye Conversation.
Elliot Perry, otherwise known as Socks.
Man, thank you. How you guys doing?
Mr. Earl the Pearl Monroe.
Hey, thank you. Nice to be with you guys.
Glad to have Mr. Allen Houston.
Trying to stay warm up here in New York.
I hear you. Personality extraordinaire, Mr. Scoop Jackson.
I appreciate the encore.
Mr. Michael Ray Richardson.
What's up, man? Glad to be here, brother.
A 3-time NBA All-Star, the one, the only, Detlef Shrimp.
Howard and Larry, thanks so much for having me. I'm excited to be on the show.
Eye Conversation. The Kazukian Network.
Kazukian.
Funky Politics.
You're listening to Funky Politics, powered by the Kazukian Network. I'm DC, sitting right here along with LT and Doc Ward. How are y'all?
Man, funkier than collard greens, sweat socks, and something.
That's funky.
That's funky.
Yeah,
That's
funky
funky.
enough. Is it funky enough?
Yeah.
Is it funky enough?
You add chillin' to that, and then you on a roll.
Oh,
you know?
my God. Hey,
Before you get the membrane out.
look, we've been visiting with Dr. Alisa Haushalter, our wonderful division director of the Shelby County Health Department, and we are just great. It's wonderful to have you on our show again, Dr. Haushalter.
I'm happy to be here.
Well, I can just see the flowing on your face, the happiness on your face.
You should.
You know what? We were setting this thing up and talking about the opioid versus a crack epidemic. And
keep saying that. There was no crack epidemic.
Opioid epidemic versus the crack problem we
There you
had.
go.
And from a black-white perspective in our communities, let's get into that right quick. Let's go there. I want to get in depth of what's the difference now.
That's the difference.
What? Black
That's the
and white?
difference. Yeah, show's over. You just did it.
Okay.
No,
That's
but
right there. I mean, but that was the difference.
Well, that's.
But the question is, so from a policy perspective, what we're calling, how did one become named an epidemic versus the other one was a problem, as MD said?
Funky politics.
Always.
I mean,
Really
that's what it
funky.
was. There you go.
And we put you on the spot on this show, by the way.
No, I want to be on the spot.
There you go.
That's what I'm here for.
You're here.
First, we got to remember we've learned a lot since the 80s. So even our understanding of addiction has grown considerably. And thinking of addiction as a public health problem is probably newer thinking. It's much like violence. I've been here before talking about violence. Right. We haven't necessarily historically thought of violence as a public health issue. It is a public health issue. So I would say we've evolved quite a bit, but also the impact of the opioid crisis or epidemic, whichever term you want to use, is impacting a broader population, and I think that's caused more of a response. Also, you have an outcry from the public health world as well as medical professionals saying, look, something needs to be done here. We're losing too many people. I said earlier, we can't arrest our way out of this. Unfortunately, many families in the inner cities of America have been damaged not only because they had family members on crack, but those individuals ended up in prison. They have felonies, they can't get jobs, and it's just a downward cycle into poverty. And so I think we have to look back and say we did not handle that well as a country, and that's impacted our families and neighborhoods in the South. Urban communities are primarily African American, but there's northern communities that are mixed, both African American and white. So I would also say urban environments where people live in poverty were impacted heavily by the crack epidemic.
So taking what you just said about, the whole we're going to go to prison now, you have a felony and stuff like that. How are prisons responding to treating inmates who go into the system for drug treatment or something like that? What are they doing to prevent them or to take them through treatment in the system so that when they come out, they're clean and they stay clean?
Really great question, because there's a lot of newer things happening that haven't happened before. So we've always had detox in the local jails and in the prisons. They're usually detox by the time they get to prison. But in the jails, we detox. People can go into different types of treatment, including 12-step programs and so on. but there's actually some newer drugs that can be used. A lot of people are familiar with methadone. It's been around a long time. But in addition to methadone, we have buprenorphine, which can be taken daily. And then we have something called Vivitrol, which is an injection. So there are some jails across the U.S. that give Vivitrol at discharge from the jail so that they don't use again. They have a 30-day window. They get into treatment when they're out into the community, and then the goal was to keep them in treatment. So we have a lot more treatment options as well.
Well, now methadone, and you're listening to Funky Politics, powered by the Kazuki Network. But now methadone, those clinics that have been around for years, are they using another drug to replace a drug? When I was in social work school, we always talked about in order to correct a behavior, you got to replace it with a behavior. So are those clinics and are the other clinics around the country that are using similar methods, are we just replacing one addiction with something that's similar or a little bit less than what they're coming into the clinics for?
So it shouldn't be that someone just walks in the door and gets methadone or walks in and gets buprenorphine. They really also need to get treatment. There was a comment made earlier about people wanting to get high. What we know fundamentally is people who use drugs have some type of pain. Usually that's emotional pain.
Yeah.
And so how do we help people deal with that pain and be able to manage their addiction as a chronic illness? And sometimes that means that you take medication as well.
So I saw something today that the Surgeon General, Jerome Adams, I think is his name.
His name is Jerome?
Yeah, his name is Jerome, and he looks like Jerome. Yeah.
Oh, I could
Jerome who?
Yeah.
Jerome. What is Jerome? Stereotypically, what is Jerome?
Anyway,
anyway, we're getting that fast. I actually heard that he made a statement today that people should carry more of the opioid overdose antidote, and he suggested that we make naloxone available, more readily available for the epidemic. So what's your statement about that being available as a treatment option or a antidote for opioid?
I support that it should be widely available.
Is it financially feasible for people to have it readily available?
So that's part of the problem, is that it does cost. I don't know the cost from pharmacy to pharmacy, and so for some individuals, they're not able to afford it. So access is not just availability, it has to be affordable as well. Really encouraging people who have family members or friends who are addicted to opioids to have an antidote available. That's naloxone or Narcan is the name brand.
Yeah, the Narcan piece. Yeah.
And some people just cannot afford to do that. So that's sort of the next wave of how do we make it affordable so that everyone has access.
I thought it was interesting that this is the first time that the Surgeon General has actually issued, the request to have one available. This is the first time since 2005. So it's been 13 years since the Surgeon General said that based on an epidemic, we need to have an antidote available, and that came out today.
Yeah.
So it's one of those things that 13 years, and we've all lived through a lot of different, I can't say epidemics, but problems, but for it to become that urgent and rise to the top.
But was that does that address crack cocaine as well?
No.
So then we still have not solved that issue.
No, but
so we still have racial disparity even amongst the addicted.
But I think what Dr. Haushalter is saying though is that looking back, it just wasn't handled properly.
Okay,
from a national perspective, it wasn't.
I'll buy that.
But she said, what can you do now to go back?
Because people are getting high today on crack.
Well, that's true.
So you got to address
families
it
destroyed in the 80s and the 90s.
Absolutely, and one thing that
they can't get those lives back.
And one thing that we did not address is that you have a whole generation of children that are the offspring of the users of crack cocaine, that a public education system is going through all types of somersaults to find a way to deliver an educational product to them that will allow them to be mainstream in society to some degree in most urban areas. But people are still getting high off crack. Crack is probably still more accessible than any other drug, because one thing about it, if you're getting black market opioids, you're still getting black market opioids. You got to go through a process for that. You can get crack on the street right now. We can walk right outside of Kazukian studios. Well, maybe not Kazukian studios, but somebody's studio. And we'll be able to access crack cocaine today. People are still, and more importantly, crack is also affixed in the criminal justice system. The sentences for crack cocaine under the sentencing guidelines, much higher than cocaine, much higher than marijuana, much higher than heroin, still have not been addressed and equalized to a point to where we are looking at crack cocaine the same way we're examining the opioid crisis. You still have crack cocaine that's been mainstreamed in as a criminal problem. So how are we going to unask that situation and get to a point to where we're treating all substances that have addiction rates in epidemic proportions, where they're all treated the same?
So I need a better understanding of this. Has opioid addiction been criminalized the way crack addiction was criminalized?
I'll put it to you this way. From a legal perspective, I have not seen opioids, the sentences in the United States sentencing guidelines illuminated the way they are for cocaine base, which we know is crack. Yeah. So I don't see that now. Of course, if you are selling it, you will go to prison. But the time frames under the sentencing guidelines are different, and they are disparate from those of crack cocaine.
But how much of that is because the sentences have changed themselves? So like the sentences for crack cocaine has been lessened,
but not to the same degree. And all I'm saying is that if you're going to pass the legislation, let's make it omnibus legislation. Let's look at those drugs, those substances, opioids, which include heroin, which include fentanyl and big pharma's black marketed drugs and so on. And let's include also Schedule II narcotics like crack cocaine and cocaine to some degree. Let's look at all of them. And also let's look at marijuana as well as it becomes legal throughout the United States, and soon will probably be legal through most of the United States. Let's look at the sentences for all of those and let's equalize them. Let's put together some real drug policy that's based on the number of people using and the damages and the effects, as we should, that come from the science and not the social aspect of it, such as where it's found, who's dealing it, who's making money off of it, and so on and so forth.
You're listening to Funky Politics, powered by the Kazuki Network. Now, Doc, I think that's a fair statement that Doc has made. Have we gotten to the point that we're looking at this thing from a health standpoint versus a criminal standpoint? And what is the health departments and what are your other colleagues around the country doing in their local communities to tell the federal government that, look, we still have an uneven playing field where the crack addicted people are still being treated as though they're criminals, but now we've got this new deal where the president said we're going to attack the opioid crisis with everything we've got from a treatment standpoint.
Even though it took him forever to designate.
Yeah, but he did do it.
Right.
But nobody's done it for the crack, and we still have that issue here, even in our local community here. Would you not say, Doc?
Oh, I agree. You know, I'm not a lawyer, so I'm not going to speak to all the laws because I don't know that they actually are as disparate. Sales of narcotics have heavy sentences regardless of the narcotic. I think what's important to think through is that in order to reduce the impact on our communities, we have to focus on prevention, so assuring that people don't have access, whether that's to opioids or crack. That doesn't change. That should be the same model. People should have access to treatment for addiction regardless of what they're addicted to. And those are the things that we advocate for. What we're not talking about that I think is really critical, we have to have a community that supports recovery. Once individuals go into treatment and come out, what is in place to assure that they stay sober over time? We also know people relapse. So how do we create a community that's caring and compassionate for recovery? And as a public health professional, I can advocate for those things. I can also work with law enforcement partners to try to get people into treatment and not into the criminal justice system. As a health director, we're actually responsible for inmate health for all county inmates. So we're actually working with UT to say what's the best model for any of our inmates who are addicted, regardless of that substance, so that they can get treatment. So I think from my sort of sphere of influence, I'm trying to make sure that we treat addiction regardless of the substance from an equitable perspective.
And the University of Tennessee Health Sciences is sitting in the city, in this county, and they have all types of resources. Have they actually come to the table and said, let's get together with the police department, let's get together with the health department, and let's solve this crisis we have? Not just the opioid crisis, but have they talked about, in any measure, about solving the issue we still have in our communities with crack?
But is that theirs to drive?
No. You've got a major medical facility sitting over there. If we're talking about health disparities, then why not it come from a place over there that can talk about it from a professional standpoint?
So that's what I'm saying. We have come together.
Oh, we have now. Thank God.
So that's been public health. That's been Dr. Stern at UT. Yeah. It's been Memphis Police and Fire, as well as Sheriff's Office and County Fire or EMS Chief Benson, as well as elected officials, to develop a comprehensive approach to addressing the opioid epidemic. But I've consistently said in those meetings, if this model works, it can be applied to other things. It's not limited to opioids, and that we have to partner across and use technology to be able to help us share information so that people get into treatment earlier.
So how does that success model that you're working on here, that you started with at the operational level, get transferred to Nashville, to the legislative level where policy has changed effectiveness?
So I can tell you, I know that UT's been at the legislature for the past weeks and months to really look at treatment. UT has what's called an addiction science center. It's not an opioid science center. So they're focused on addiction more broadly. And I know that they've had lobbyists at the state level trying to influence policy there to focus on treatment and allocating money. One of the things that we didn't talk about is if you look across the state, Shelby County actually has less deaths from opioids. So we're not likely to get a lot of resources because we're behind everyone else.
Is it because this is urban and you talk about Eastern Tennessee being rural and that whole difference?
Yeah, and because you got people here that use crack cocaine. These black people live in Memphis, and that's what you're gonna have. It might sound ugly when you say it, because it is ugly when I say it, and people need to hear it's ugly so they can get part of doing something about it. Not Dr. Haushalter. She's doing what she can, but other people that are listening. You have African Americans, you don't have as many opioids. I think Prince might be one of the, and I'm talking off the cuff.
He's in Minneapolis too.
He's in Minneapolis.
He was
different.
Yeah.
So yeah, of course it is. But if you flip that and talk about crack, we're probably number one on a rocket ship.
Well, I'm not going to agree to us being the number one spot on the rocket ship, but I will say that, in terms of African American community, with respect to crack, it's up there.
The Tennessee rocket ship.
The Tennessee rocket ship. You want to call it the Tennessee? You crazy? The Tennessee rocket ship. But you know what? We've got a lot to do in our communities. But I'll tell you what. Let's do this. We're going to be right back. We're going to talk to Dr. Haushalter about some other community activities that are going on out there that are not getting as much support. So you're listening to Funky Politics right here on the Kazukian Network.
Funky Politics. Riffin' on jazz.
This next gentleman we're talking about has an unforgettable voice.
My sugar is so refined.
Jazz was the happiest. Al Calloway went to my school.
Oh, really?
Yes, he's not an alum because he didn't graduate. He has some gigs to do.
Riffin' on jazz on the Kazukian Network.
This is Dr. Alisa Haushalter, and you're listening to Funky Politics on the Kazukian Network.
Back at you with another Funky Politics right here on the Kazukian Network. I'm DC, sitting along with my coloring buddy over there. Doc Ward, how are you, Doc? I said coloring buddy. I didn't say colored buddy.
No.
Didn't say that.
That's totally not true.
That's not true? You don't color?
No. And not with you at all.
LT, how are you doing now? I'm not even talking to this guy over here.
I don't even know where to go into this. I'm doing great.
You're doing great. Good.
Man, I need to give you a book on urban jargon.
Because coloring buddy was wrong?
It is totally wrong.
Yeah, maybe I should take buddy out.
Okay.
I'll just take it all out.
Take it all out. I want to take it out. Hey, sitting here with Dr. Alisa Haushalter, our wonderful division director of the Shelby County Health Department. Sitting in I tell you, we're having a great conversation with you, Doc. How are you?
I always have a great conversation when I'm here.
Let me tell you something. When you're here on Funky Politics, it just lifts up the room in this place.
That's usually because DC's not here. It's usually because us talking about things. Then we can have good conversation.
I want to put on a spot today, though. I want to talk about something that I know is dear to a lot of people's hearts, and that's this. It's this piece on women's health and how I think I believe, in my opinion, that there is a all-out assault on one particular agency who has, I think, down through the years, have served women in terms of women's health, no pun intended. Yeah, but not with just reproductive health, but with other issues. And the Congress, the president, most of the state governors around, especially the red state governor, are attacking Planned Parenthood. What is the deal, Dr. Haushalter? What's the deal? Even in our own state of Tennessee, we roll back funding for what I believe is a most needed service that they provide.
I'm going to reinforce the need for people to vote and get involved in policy and politics. So our elected officials make policy based on those who put them in office. And that's at the state level, it's at the local level, it's at the federal level. And so policies around funding of Planned Parenthood have come out of elected officials. Once they set those policies, unfortunately, as a public servant, we have to defer to those those policies. But I think the broader item is about access to reproductive health services for not only women but men as well. And there are a variety of organizations that provide those services. The health department, we provide those services, as does many FQHCs and other healthcare providers and Planned Parenthood.
But as a health professional for well over 30 years, I mean, some of this stuff that's coming out of these legislators' mouths, you've got to be sitting back and just scratching. You're like, what in the heck are y'all doing?
Well, I mean, it's even, but you know what? Talk about it just straight up. Because talk about in the context of what's going on. Because I think what you had was a situation where the former director, Planned Parenthood now, has come out and said that she felt like she was bribed by the president's daughter and her husband when they talked to her about potentially providing her with some additional funding if she would stop funding abortions, or at least decrease funding for abortions.
I didn't hear that part.
You haven't heard that part?
No, I didn't. Oh, wow.
That's in the news, man.
Oh, okay.
Yeah. Everybody else has heard it. Haven't you heard it?
No, I haven't.
Oh, okay, well,
I'm sorry.
maybe that's too.
You sure that's not fake news, though, right?
I don't know if it's fake or not, but that's really what the situation is right now going on with them, and so one of several. But it's to the larger point that people believe that Planned Parenthood is about nothing else but providing abortions. It's about, but when really the as Dr. Haushalter was saying, the subject matter is women's reproductive health care in all forms. In all forms and fashions, and that which is vital to the life of a woman, So you can go on from there, but I'm just saying that's what it comes down to, and the values that people have, particularly in those certain areas and clusters where they believe that Planned Parenthood is doing nothing else but providing abortions and the religious beliefs and everything else associated with that.
You're listening to Funky Politics, powered by the Kazuki Network.
I grew up in a rural community that didn't have Planned Parenthood, but we did have a local, health clinic that, young people went to get services and things like that. So with all the debate that is discussed nationally about Planned Parenthood, are more funds being given to the local health services or local health clinics to help address some of the need? For reproductive rights?
The amount of funds hasn't necessarily changed. It's just distributed to other agencies, which is what I said earlier. There are a lot of agencies that provide reproductive health services. The health department is one of those. Choices is another one of those. Planned Parenthood is another. And any of the federally qualified health centers generally provide services as well.
So if you're a young person, a young woman in a rural community, you can still go to your public health department and you can get birth control or any types of birth control. You can get the testing for your health and all of those things. I want to make sure that everybody understands that we put all this focus on Planned Parenthood, but there's still other means and other avenues out there of getting those services.
Definitely. And a local health department is one of the places that individuals can go for services. And we're talking about women's reproductive health, but men also can receive services.
No. I hear you, Doc. I hear you, and I hear Doc Ward, and I hear LT, but I want to get to the meat of this thing. They're cutting the funding to Planned Parenthood, and it's only because of abortions, because they have in the past assisted with terminating pregnancy. Let's just call it what it is.
But that's really only like 3% of the services.
But the number. But now, because of 3% of services, you take out 97% of help to rural and urban communities.
That's not what I heard, because rural communities don't have Planned Parenthood. That's the thing.
But if you get access to, let's say you live in Stuttgart and you come to Stuttgart, you come to Memphis or you come to Marion County, then guess what? If the funding levels have been cut by the fine state of Arkansas and the fine state of Tennessee,
Planned Parenthood, but what I heard Doc say is that I can still go to my local health department for all of my other needs.
But there are some things that they cannot provide at the local health department. Am I not right? That some of these, like Planned Parenthood, can provide. And I'm just please make me and I'm not, of course, not a lady, so I'm not going there to get those things. But I'm sure there's some things that you all cannot provide that they do.
Generally, all of the reproductive health services are going to be available at a local health department or other like federally qualified health care centers. Those services are available. What we don't provide is abortion services.
But we never have, though, have we?
No.
We never have. Okay.
So you still get your needs addressed, and I understand that the money.
But the state provided the monies for those young women, for those people that had those issues. At some point, Planned Parenthood was getting money to do something, and I guess the addition of the private funding probably was paying for these termination services, no doubt.
Planned Parenthood receives funds from a variety of and some of it was through federal funds that actually come through the state. It's not
Pass-through
all
funds,
state dollars, federal pass-through dollars, as well as donations, and you can pay for services.
Yeah.
So it's a combination.
But I think this kind of segues us into a lot of the conversations that we've had today. So we talked about, medical services. We talked about, because Planned Parenthood is generally affecting what's happening in low-income communities. It's everyone, but the problems in low-income communities. So how do we take the drug epidemic that we started this conversation with, reproductive rights and things like that, and talk about how all of this impacts people in lower income communities?
You talking about poor folks, people impoverished,
poor folks,
black folks?
How does Planned Parenthood impact it?
Well, no, all the things that we're talking about is the treatment in lower income communities different than in higher income communities.
I think in a higher income community, because let's just get this, because we talked about it, but the deal is this: Health Department and Planned Parenthood provide the same women's reproductive services, and Dr. Haushalter has also said they provide services for men as well. The thing that the Health Department does not provide are abortion services. So Planned Parenthood is going to be under the spotlight because they do provide those services for that purpose, even though they would say that abortion services only account for 3% of the total amount of services that they actually provide. They're spotlighted politically because no one else is providing those services for the public at large. People that have the means are going to their private doctors to have those services done. So they're going to be under the spotlight. And also, given the issue, they're going with the current president and his son-in-law and his daughter, they're going to be under the spotlight. So Planned Parenthood is going to be they're going to be there. But they're a political organization, and they delve in the political realm. That's why Dr. Haushalter was saying, vote for the candidate of your choice and find out what their platform is going to be on those issues, because that's where anything affecting Planned Parenthood is going to be affected.
You're listening to Funky Politics, powered by the Kazuki Network. I understand all of that. I am simply saying they're throwing the baby out with the bathwater over the 3%.
Don't say that.
Well, okay. They're throwing the cat out of the litter box.
Robbing Peter to pay Paul.
Exactly.
Whatever.
Because of 3%. Though.
It's cutting off,
because of 3%. And the 3% that they weren't even paying money toward. But now, I digress.
But that's because you have so many pro-life people that are making laws for the country.
And mostly of them are men.
Well, they may be.
And mostly are men.
They are men, and I understand.
Percentage-wise, in the Congress, you got more men than women.
And I understand why women feel the way they do about it. I feel the way they do about it. No one should be telling anyone what to do with their body. Yes, we get that. But the reality is this. You have pro-lifers that are the majority in Congress right now. And as long as, and when I say Congress, I mean all Congress.
Sure.
I don't mean just House of Representatives. I mean House of Representatives and Senate and the executive branch. So those initiatives that are akin and associated with that party, the Republican Party, which one of them being, I wouldn't say abortion control, but
right to life.
Right to life.
That's what they call it.
Those are going to be the things that are going to be on the table as part of the agenda to get moving. So as Dr. Haushalter said, again, if you want to deal with Planned Parenthood and the issue of abortions and the funding that they're getting, that's something that's only going to be resolved with your vote. Now, as it relates to, I guess from a public health perspective, and we talk about abortions, how is that? Is that a public health concern that you all are having? Are abortions now happening at a higher rate, lower rate? I think the sort of leveling off last stat I checked in terms of rate. But is that growing to any level of concern with you all right now as far as pregnancies or unwanted pregnancies or teenage pregnancies?
What we focus on very heavily is reducing infant mortality.
Okay.
So Shelby County historically has had higher rates of infant mortality, and we know if pregnancies are planned and there's adequate spacing between pregnancies and moms are supported to breastfeed, it reduces our infant mortality rate. And so that's actually where our heavy emphasis is. We don't keep data at the health department on abortion rates at all.
Right.
We're really focused on healthy moms, healthy babies, and healthy families, and helping women have the information they need to make the right choice about reproductive health.
So let's talk about what.
Hold on, let me ask. I want to follow up on
go
that.
back to Planned
Do any health departments keep information that you know of as a public health professional? Any health departments keep information on the number of abortions, and if that's the case, then how do they know how many are being had every year? Somebody knows this number.
They're generally reported by the agencies that do them, but they don't report to the health department. So each state has mandatory reporting laws.
Gotcha.
Certain things are reported to us. Let's just say syphilis rates.
Yeah.
If someone has syphilis, they have to report that to us. Someone has TB, they have to report that to us. If someone has an abortion, that's not reported to a health department, either local or state.
Gotcha. Okay.
So you said educating women on making choices and families on making choices. One thing you said the amount of pregnancies and the time between pregnancies and things like that. Yeah. Could you just, because there are people that are listening that probably are saying the same thing to me, same as me, what does that mean as far as women? Is there an amount of time in between, and how the healthy pregnancy process, what does that really consist of?
So to have a healthy pregnancy, it's important that women are healthy in general.
Right.
So they eat well, sleep well, do the basics.
Right.
We really encourage people to take folic acid so that they're healthy and don't have babies with neural tube defects. And then once someone has a baby, we really encourage them to wait at least 18 months to have another baby. If you have the spacing a little bit wider, the babies tend to be healthier, and you have lower rates of infant mortality.
Well, let me ask you that now, because my sister and I, and this is personal, my sister and I were born in the same year. She was born January 16th of 66. I was born December 10th of 66. So apparently there was not an 18-month wait.
And the evidence is clear.
Well, no, but literally,
there are plenty of babies that are born closer together, but the research and the data tells us if they're spaced further apart, they tend to be healthier and have lower rates of infant mortality. The other is if women have had a premature birth previously, we really encourage them to get into prenatal care earlier, because there's ways now to help prevent that early delivery.
Wow, what amazing. I tell you. LaTanya, you got that look on your face like, I'm on my third kid here and I want to talk to him. No, I'm just joking.
Right, let's get it right, because my husband might listen.
No.
He's one child.
He is listening. What did you get? One kid, that's it.
One child. Yeah, don't
folks,
put that into our house.
We've had fun here talking today, and we hope that you have gotten a lot out of this conversation with Dr. Alisa Haushalter, who happens to be the Division Director for the Shelby County Health Department. And you're listening to Funky Politics, powered by the Kazukian Network.
Staring in the mirror, gonna change my ways. I wanna make Memphis a better place. I see your neighbor in me, but what can be done? Instead of buying shoes or a pretty dress with just $1 a month, you can help the rest. It starts with you. Plus one.
Giving back through Plus One will make a difference for families in crisis.
It starts with you. Plus one. Grandma's message couldn't have been any clearer. If you wanna change Memphis, look in the mirror. It starts with you. Plus one.
I remember when we got help from Plus One.
And now we're helping others.
Hey, Memphis, you can make a change.
You too can make a difference.
The off-year electorate, the midterm electorates, are older, less diverse, more conservative. You have two electorates fighting for the future of this country. And what I'd say to your viewers and people listening in is, you know what? You got to stop that older, less diverse electorate from funking around with your future.
Funking up your airwaves and jamming the good information in your ear. Once again, it's Funky Politics.
Funky Politics.
Funky Politics is on.
We always say the revolution will not be televised, but it will be podcast on Funky politics. But DC, we had a little bit of the revolution not too long ago as Memphis, Tennessee. And I'm not going to say celebrated. You don't celebrate someone being assassinated. But Memphis,
they tried,
Tennessee, though. Memphis, Tennessee commemorated the life and the legacy of Martin Luther King on the 50th anniversary of his assassination just recently. And I know that you were a participant in a lot of the events there, and you really got a chance to get into the essence of it. Can you talk to us about that as we go on out? What do we need to do now? What's the state of the dream? Where are we going?
You know, the question was, where do we go from here?
Yeah.
And if the MLK 50 activities I saw were the impetus for that, then we're lost.
Wow.
Until the next 50 years.
That's a strong
I
statement.
saw complete disunity. I saw 4 or 5 major organizations in my city that are, and some that are national, flub this thing. Instead of us coming to the table and working and saying, look, this man deserves all the honor and praise. He's not Jesus Christ, but he was someone who walked around with a lot of our grandparents and our parents, and they talked with each other, and he tried to spur us to something that was greater than what we were. And we could not sit at one table and decide on 5 or 6 or 7 or 20 things that we could all do together in terms of unity.
Wow.
I saw several organizations do their own thing, and I'll tell you what, it was disheartening.
Wow, but if you're watching like I did a lot of things, I was spectating, watching on television.
Sure.
It seemed like things that were going along went along in a very good and streamlined fashion.
Oh, were they scripted well? No, some of them were extremely scripted well, but understand this. When you've got a major piece going on at one venue and you've got another one going on at another venue, and they're similar, but all they had to do was bring them to one particular venue, and we could all enjoy together, black and white, labor and business together.
Wow.
And we had them all separated and segregated. It was absolutely.
So you're saying the barriers of race, class, and other
class
areas are still affecting us even 50 years after,
yes.
even when we're celebrating the man that had a dream that all of those things would be, that we would, all the barriers that divide us.
Ask
would
the
be
average
broken down.
Memphian, ask the average Tennessean, ask the average Mid-South person who came, how many of them participated in any of that stuff? A bunch of this stuff was private ticketed. Some of it you couldn't get into.
Right.
You turned away. You arrested activists on a day that you were supporting the life and legacy of a man who believed in activism.
That the revolution won't be televised, but it'll be sold to the highest bidder?
That's what happened.
Wow. That's deep. That's deep.
That's what we do.
But I guess it just goes to the bigger question. Why are you asking yourself, where do we go from here 50 years later?
No.
That was the question for 1969, not 2018. But you've got to start somewhere, and hopefully this will be the start of a series of us coming together as people to understand that each of us has a worth, each of us has a mission, and it is our duty to help each and every one of us do what we can to make this world a better place. Isn't that right, LT?
All focus on the least of us. We must never forget that you have to do the work for the least of us. And so out of all of that that happened, the one thing that I'm proud to see is that labor unions, the Fight for 15, and all of those people represented well and represented the diversity of this country.
They were here, and they were strong.
Here,
and
they were united.
Yes, they were.
And as we said before, diversity is the only way by which we win, no matter where we are. We have to continue to celebrate the best and the brightest of each of us. But until next time, it's time for us to get off our heels, get on our wheels, and truck on out of here. But until then, we always implore you, demand you, command that you keep it real, keep it right, and keep it what, LT?
Funky.
Keep it what, DC?
Funky, funky.
Keep it funky, funky, funky right here on Funky Politics.
Funky Politics executive producer Larry Robinson for Kadzukian. Hosted by Daryl D.C. Catron and Marcus M.D. Ward. Guest bookings by Miko. Funky Politics recorded at Kadzukian Studio. Directed, produced, recorded, and distributed by Kadzukian.